Welcome to another Forum Onslow. I'm Ralph Leeds, Chairman of the Chamber's Governmental Affairs Committee. And on behalf of the Chamber's Governmental Affairs Committee, I'd like to thank you for joining us for this very important Forum Onslow. The Governmental Affairs Committee works with government agencies on issues that affect our business community. We monitor legislative issues that impact local business, and we promote partnerships between business, the government, military, and educational institutions. And we use these forums to create awareness on topics that are important to our entire community. I would like to thank our media sponsor, the Daily News, the City of Jacksonville, for their use of the facilities and assistance. I'd like to thank Chief Mike Yanira for bringing us this topic to the Chamber and to the other folks he has assembled to serve on the panel. Our corporate sponsor is Duke Energy, and at this time I'd like to call up Millie Chalk, Duke Energy's District Manager for Government and Community Relations, for a few words. Millie?
Thank you. And on behalf of Duke Energy, welcome to Forum Onslow. Duke Energy is proud to sponsor with the Jacksonville Onslow Chamber of Commerce this forum focused on our nation's opioid epidemic. You know, everyone's interested in maintaining the vibrant communities here in Onslow County. And one of the challenges facing our community is the overprescription of opiate pills. These drugs do not discriminate. I hope we can all leave this forum and better understand how this crisis impacts all of us, and more determined than ever to assist our neighbors. Duke Energy has a proud tradition of leadership and engagement in our communities and is proud to sponsor Forum Onslow.
Hello, my name is Elliot Potter. I'm the moderator for tonight's program. I was honored that I was asked to do this. It's something that I have felt deeply about for some time now. It's something that I see that has gripped this community, but has also gripped the nation as a whole. As a matter of fact, on August 10th, President Trump declared the opioid crisis in this country to be a national emergency. It is a serious problem, he said, the likes of which we have never had. And I think regardless of how you might feel about the president, you got to admit those words are true. Nationwide, at least 21,000 overdose deaths were attributed to opioids last year. An additional 30,000 overdose deaths are attributed to heroin and powerful synthetic opioids. Drug overdose is the leading cause of death for Americans under 50, and that death rate is increasing. Nationally, 78 people die every 24 hours from a drug overdose. Overdose costs the nation $20 billion in emergency room care and an additional $55 billion in other health and social costs. But our resounding call here in Onslow County came way before the nation's the declaration of a national emergency. To me, in my mind, our big wake-up call came in April of 2016. 2016 is the correct date. I thought it was 15 there but it does not seem that long ago. Two young men in southern Onslow County died within 24 hours from a drug overdose. It was a 24-hour period, and those were promising lives that were lost. We have the mothers of both of those young men with us here today, and we'll hear from one of them a little bit later on. So we have seen the abuse of opioids in Onslow County and heroin and other opioid-related illicit drug use as a community crisis for a pretty good period of time. We are so thankful to the people that have already picked up the fight, and that's one of the reasons that I think we're here today. A national report, Caslight Health's The Opioid Crisis in American Workforce, ranked Jacksonville as the 12th top city for opioid abuse rate in the United States. It cited 8.2% of people in the community receive and abuse an opioid prescription. Think about that. That's very close to 1 in 10. In the state of North Carolina, prescription opioids were linked to 738 deaths in 2015. Heroin and other opioid-related illicit drug use were linked to 291 deaths. That totals more than 1,000. By comparison, cocaine use claimed 363 lives during that same period. So it dwarfs that problem. While the toll on lives and the families left behind is heart-wrenching, we have no choice but to deal with all the other consequences as well. Our local governments are struggling to provide the financial resources for law enforcement, criminal justice, and treatment. Our hospitals are being tasked with a troubling overload of drug abuse cases in the emergency rooms. And our political leaders are expected to find an answer. They're expected to find an answer when sometimes there is no single solution that exists. To our panelists, I would like to bring you a brighter scenario in regard to this problem, but you folks would know better. And I think the question before us today, though, is how, as a community, are we responding? Now, the way we're going to work the forum today is we have all these folks up here, and it's a pretty distinguished group, but we divide them into three groups. One group will tackle the problem with the question of what is the problem, and that's Sheriff Hans Miller, the Onslow County Sheriff's Department. Thank you, Sheriff, for being here. Dr. Penny Burlingame Deal, the CEO and president of Onslow Memorial Hospital. Thank you, Dr. Deal. And Robin Knapp, who is Onslow County Commissioner and also is retired NCIS, so he has worn a couple of different hats and seen this problem in a couple of different ways. Then we'll move to the panel on what are they doing now. And on that panel is Chief Mike Yanero, and he is the Public Safety Director for the City of Jacksonville and Chief of the Jacksonville Police Department. We have Ernie Lee. Thank you, Ernie. I know you're missing a big celebration, and maybe we'll let you get back to it.
My wife's birthday today.
Yeah, that's right. Misty's birthday today, so you don't want to miss all of that. But he is the district attorney. Rob McCartney is from the Barry Robinson Center. Thank you for being here, Rob. And Jay Kortenmeyer, excuse me. Thank you, Jay, from Bryn Mawr Hospital. And then we will move to the question finally for the final panel of where do we go from here? On this panel is going to be Mayor Pro Tem Mike Lazar, City of Jacksonville. Senator Harry Brown. He is he kind of controls budget strings, I hear, in the state budget. So he sees this problem not only for one county, but for an entire state. And but we appreciate you being here, Senator Brown. And Paul Buchanan, who is the Onslow County Commissioner and also former law enforcement officer. So we do have a very experienced panel in dealing with these, this issue. I'm going to move to the first group, though, and we'll start with just to go right through the panel here with Robin and Commissioner Knapp, Sheriff Miller, and Dr. Deal. And I would like for you guys to address this problem. You've seen the impact of the opioid crisis firsthand. How would each of you size up the problem in the county as a whole and in your organization specifically?
I think probably the biggest problem is the availability of chemicals that are destructive to the body and also to the mind of the people once they get addicted. We have a availability of opioids and other drugs as well, hard drugs, what we consider hard drugs, that in some cases all it takes is one dose to be addicted, and then once somebody is addicted, they want more, and it's almost like there's a hook placed in them. We have the availability of these chemicals. I consider them poisons because they poison the body and they poison the mind as well. And particularly for our young people, it is a problem, and it's not a problem that is easily solved. It takes a national level, it takes a state level, and it takes a local level, all of us working together and with our citizens to be aware that this problem is out there. I think one of the things is public awareness. And partnership between citizens and their government and the medical community and so many other things that we can do together if we work as a team.
Dr. Deal, what do you see at Onslow Memorial? How has it impacted you there?
Well, and thank you, Sheriff Miller. I completely agree with what he's saying as far as the unprecedented availability of cheap heroin and fentanyl, synthetic narcotics. The fine point being that we see that, but in addition to that, there's a prescription medication issue as well. And so when I signed up for this, thank you, Chief. When I signed up for this, I looked at some additional statistics like you were referring to, and at the state level, from 99 to 2016, I found it interesting that opioid-related overdose deaths have increased, ready, by over 800%. That is basically resulting in over 12,000 needless deaths. According to the CDC estimates, that's about $1.3 billion attributed to the overdose deaths related to opioid just in the state of North Carolina. And of course, as Sheriff Miller said, that's really confined to at least the predominant age group or age cohort is 25 to 34. And it's not lost on me that all 5 of my children fit into that age cohort. So my heart goes out to anybody who's been touched by that. So for us, when it comes to prescription medication, there was a very well-intended and legitimate piece to this. Oh, there's one other statistics I should share with you. For this past year, not even the year, not even the full year, January 1 of this year through October 4th of this year, we pulled up a report and looked to see the number of complaints that come into our emergency department that are pain-related. Pain-related. Of course, you follow that thought through, it's 18,734. 18,734 patients came into our emergency department with a visit and a chief complaint of somehow related to pain. Obviously, the next step would be to address that pain now. There was a survey that was developed in 2008, and it is known as the Hospital Consumer Assessment of Healthcare Providers and Systems, HCAHPS survey. You've probably heard of it. It's an offshoot from the Affordable Care Act, really, and value-based purchasing. It's specific to hospitals. And the intention behind it was very, very good. It was designed to measure and gauge the patient experience in an effort to drive quality health care, so very good. But reimbursement is linked to it. And so reimbursement is linked to the patient's perception of care through HCAHPS that includes different domains. One of the domains is pain. And I'm going to tell you the questions that they ask. How often was your pain well controlled? And the other question is, how often did the hospital staff do everything they could to help you with your pain? Reimbursement is tied to how well you do on those questions, on the response to those questions. So this survey includes a battery of the questions that we just went over, including pain assessment and pain care. And the unintended consequence of that could certainly be increased prescribing of pain medications and opioids as a result of financial pressures. So again, to make it a bit more personal, put that into the context of from January 1, 2017 to present day, we saw 18,734 patients who walked through the door with some complaint of pain. Kind of emphasizing on pain management linked to reimbursement. It encourages providers, or could encourage providers, to prescribe pain medication in order to prevent the realization of monetary penalties as a result of patients' poor perception of patient pain management. There was some good news. The final proposed rules from CMS that were released in November 2016 that would be effective this calendar year has determined that, and this is a quote, they're finalizing the removal of the pain management dimension of the HCAHPS survey for purposes of the hospital value-based purchasing program to eliminate any financial pressure clinicians may feel to overprescribe meds, end quote. And while that won't entirely remove that pain domain, they will restructure the questions. At the local level, here in our own community, our pain management resources, for example, our military partners or Johnston Pain Management, they are looking, and we need to continue to do that, to look for creative ways to realize the intent of the survey, which is great intention, without creating unsafe and irresponsible situations prescribing for our community and patients with things such as opioid safety education programs. But finally, while resources in the community have banded together and community leaders, and I'm going to take the opportunity to thank Senator Harry Brown for what he's done in reallocating funds to come back to Onslow County for mental health and substance abuse. We appreciate that. But to address the current issues, we've all bonded together. But the availability of those resources relative to the sheer number of those in need are inadequate given the scope of the problem.
Thank you.
You're welcome. It's all you now, Robin.
Commissioner Knapp, I know that you sort of wear a couple of hats here.
I do.
And as you mentioned to me before the forum, we might have asked you to do a little bit talking about, you have a background with NCIS. I know that there are a lot of aspects of this that don't go straight into law enforcement, but, you know, we are a military community. Our population skews young for that reason. Do you see a connection there? And if there is a connection, how are we as a community going to be able to reach out with our military residents and our military neighbors and to make something, and so that we're making sure that we're all moving in the right direction?
Well, let me address your question right after I address what I see what the problem is initially. I think it's systemic with us that we always wait till something happens before we realize we have a problem. That's the problem. I'll tell you right now, heroin has been around since the 60s. In 1990, when I got here working drug cases, my first case was a heroin case out of Sneads Ferry. So it's always been here. Every law enforcement officer will tell you that the heroin coming into North Carolina for the last couple of decades has been coming in through Wilmington, North Carolina. So it's been there. And that's part of the problem. The problem is that we wait. We don't want to recognize the problem. And that's just not with law enforcement. It's from a community standpoint, and it's from a political standpoint as well. I mean, one of the reasons why I ran for county commissioner, because I wanted to be involved in that political aspect to make awareness that there is a problem. The problem's been here for a long time. It's unfortunate that it was brought to the surface because of some unfortunate, untimely deaths that we're all sad about. But this has been ongoing. And the problem is that we don't want to recognize it as an issue. We don't want to recognize it from a hospital standpoint, from a civic standpoint. We don't want to look at this as that there's an issue in our community. We look at heroin, we look at addiction as something that happens in the big cities, in the inner cities in Chicago, Philadelphia, where it can't happen in hometown USA. But it's very, very prevalent. Now here, with 70,000 Marines that have just gone through several campaigns of war, battle injuries, pain, I mean, things that you've never seen before in your life, they're being prescribed medication that are opioid-based, that are going to help them with their pain relief, and it's very addictive. You know, the brain is made up of opioid receptors. They're very sensitive to opioids. So if you infuse those opioid receptors with opioid-type drugs, it's highly addictive. Okay, it releases the pleasure, it relieves the pain, and they come to rely on it. And that's the biggest issue here, is that we didn't recognize the problem. We were easily prescribing this medication for any type of pain. Just like a kid, when a kid, not too long ago, that was hyper, what did we prescribe him? What was the common cure? Adderall, Ritalin. Okay, that was the easy way to do it. And part of the problem too is that we have procedures that are implemented here that we as medical professionals, we as providers are not checking either. Okay, we have the CSRS, Controlled Substance Reporting System. Do you know in April of 2016, 6,835 entries were made. Only 21 queries were made. That is ridiculous for a population of 186,000 in Onslow County. What does that tell me? That tells me that providers are too lazy, not all of them, I'm not trying to offend anybody, but I'm saying they're too lazy or they don't have the time to look into this particular system that's in place to help identify those individuals that may be possibly addictive or doctor shopping. So we need to unite. We need to approach this problem, in my opinion, from a three-prong approach, okay? The first prong is education and prevention. That is necessary. And I know they're doing a great job with HOPE and everything else in Sneads Ferry, and I commend you for that. The second part of that is treatment. It was recently said in a recent board about those in the pipeline. Those in the pipeline are the ones that need treatment. Those in the pipeline are the ones that need our help because they're addicted and we need to get them off of that. And then the third prong of that is law enforcement. Law enforcement identifying the dealers, the people, the mechanism, how they're bringing in these types of drugs into our community and how we can go about doing counter-narcotics activities, how we can go about doing drug interdiction to prevent this. We're not going to catch everybody. But with that three-prong approach, then we need all three particular areas to join together as one, as a community, and work this together. And I think we're finally starting to do that, not only from an elected position, not only in the local position in terms of law enforcement, but the community as well. You see all the people that are involved. And the big thing is we just need to understand that we need to recognize this. We should have recognized this as a problem many years ago. I'm glad we're recognizing it now, and now what we need to do is move forward to combat this thing as a team, the whole community involved, because that's what it's going to take. And the other part of that too is not just with our community, but all those out there that are not aware of what's going on, and we have to educate them as to the dangers of this. So from the military standpoint, the military brings a unique animal to the table, okay? You got a lot of veterans in here, you have a lot of people that are injured, a lot of people that require treatment, and they're in a lot of pain. So we are going to see an influx of that, and we're going to see a stronger rise in addiction because there is pain management, and that is very important, and a lot of these individuals rely on these types of medication to help get them through the day. And we need to find alternative ways to get them through.
Okay, thank you.
And I think we need to realize that addiction is a disease. Supply is a crime, but a lot of times there's overlap because people that supply to feed their addiction. So I would say that let's cut off the money supply from the supply line, and I've said it publicly, maybe a 3 strikes you're outlaw. If 3 felony drug dealings, you should go away for 20 years.
Okay. Gentlemen, ladies, we had, I mentioned earlier that we had some family members here that had been personally involved in this, and we mentioned the Operation Cope, I believe it is in Sneads Ferry. And we have Cindy Patain, whose son succumbed to an overdose in April last year, 2 years ago now. And, pardon me? Year and a half ago, yeah. But she's here with us, and she's going to present a question to you, to this side of the panel.
So my question is also for the law enforcement, and I just have to say that I do work closely with Sheriff Hans Miller. He attends our monthly HOPE meetings, which will be next Tuesday night is our next HOPE monthly meeting at Salem Baptist at 7 o'clock in Sneads Ferry. But my question is, from the law enforcement perspective, do you think, or should every drug-related death be investigated as a homicide?
In my opinion, this is my opinion, when somebody provides what I consider a poison to another human being, and that human being dies as a proximate result of that, I think that would be a good charge to place, because if it were not for that, that person, that victim would not have died. But it depends on the circumstance. We have to take a look at all the circumstances. And that's typically a criminal investigation. We look at everything. But I think recently we had success. We worked with Pender County, and we had a second-degree murder charge
The woman
upheld.
that sold to my son is now in jail, 33 to 54 months with all her charges, but she pled to involuntary manslaughter after being charged with second-degree murder. Robin?
You know, throughout my career, fortunately, I haven't seen a lot of overdoses. There have been overdoses. But I absolutely agree that if someone is out there pushing this stuff and you get a conviction and you know that they got this particular item from that particular dealer, absolutely, we should go all the way and prosecute these individuals because they're responsible for peddling this poison. They're responsible for pushing this on the street. They're the ones that are responsible, and they know what they're doing. Half these dealers, or the majority of the dealers, I should say, don't even use their product. They're not in it to use their product. They're in it to make a profit. And they're making a profit out of those who are addicted to this particular drug. And to me, that's just pure evil. And if you're going to do that, then you should suffer the consequence, especially in the event that someone is injured or somebody dies. You should be prosecuted to the full extent of the law. The case should be developed, and hopefully that you'll get the maximum sentence allowable under the law.
So one of the things that, Robin, that you said earlier was that it's always been here, just nobody talked about it. Nobody wanted to admit that it was in our community. And, you know, I was guilty of the same thing with my own son, but that's one of the things that our group, Sneeze Fairies Hope, which stands for Heroin Opiate Prevention Education, has worked to kind of try to remove that stigma associated with drug use and overdoses, to try to encourage the victims or the individuals that are using to seek help. So if we apply the law that says if you sell this opioid illegally, you can be charged with second-degree murder. So if we apply that law consistently and investigate as a homicide, then that sends the message to these users that they are valuable, that their lives are important, that just because they're a drug user, they don't matter. But then it also sends a message to the dealers that they're going to be held accountable, because right now they're not afraid to sell because very few have ever been held accountable.
Can I make a comment to you're absolutely right. And first, I want to commend you guys for what you're doing. But I tell you what, and I'll be the first one to admit as a law enforcement official, it's our fault. From the very beginning, it's our fault. We assume responsibility as LEOs because we didn't get out there and push the education out there that we needed to. Okay? It's our fault in the sense that we didn't try to go educate individuals, and it's our fault from the sense that a lot of the perceptions that a lot of law enforcement has, that we're going after the drug dealers and we get users that are caught up into it, the perception by society and others is we kind of look away, that we don't kind of look at them as humans. I know that for a fact because I investigated these cases. We're always looking for the dealer. We're always looking for the next guy up the rung of the ladder, but sometimes we neglect all the stuff that this dealer has done in the wake of what he or she is trying to do. I had a particular case, a drug dealer, we chased him, ran into the house. One of the ladies that was selling dope for him was addicted. And what really hit home with me is her 2-year-old child was laying down on the floor, sleeping in a blanket full of excrement. Okay? That hit hard, and that's one of the things that kind of motivated me to run for county commissioner, because that shouldn't be that way. And we need to get these people the help that we can. And again, people that are selling dope and someone dies,
Well, I
okay,
think that
should be responsible.
You see, that kind of goes along with your stigma, the same as we did.
Exactly,
Vanessa's son and my son were star athletes.
absolutely.
Some of the most popular kids in the high school. I've been teaching in Onslow County for 23 years, yet our kids both still succumb to overdose deaths. And that, I think, is what made, unfortunately, a difference in our community, was that we started to see it affect a different type of people, and it does affect everybody. It's not limited to just a certain class of society.
And again, you're bringing out the good point of everybody getting together and working together, and I applaud you for your efforts.
Oh, before we move on to the next group, I do want to ask another question of Dr. Deal, which was, you talked about the pain management aspect that the hospital is and certainly that's sort of getting in front of the ball and before it runs over you. What about the emergency room and the challenges you have faced there, and just in the treatment aspect of it? Is this put the hospital, your emergency personnel in sometimes very difficult, if not impossible, situations?
Absolutely. It puts the emergency department in difficult situations because, and I don't want to ignore the fact that there's another element to this, and it's oftentimes, yes, we have the dealers, we focus on the dealers, but the patients who come in with opioid abuse and overdose are suffering from other problems, and oftentimes there's a mental health issue. So it speaks to a gap in mental health as well. I just want to make sure that we acknowledge that. And that gap in mental health, oftentimes these patients who come in, they've overdosed, they're trying to self-treat. So again, lack of resources within the community. When it comes to pain management, to try to get in front of it, what we see in the emergency department, typically what we're doing is what an emergency department is designed to do, which is treat the emergency, the acute event. But truly, when it comes to pain management, that's more of a long-term resource that should be utilized in order to address the addiction or the need to self-medicate. So again, it's overwhelming sometimes for the emergency department simply because we don't have the resources in the community to address the larger picture and prevent the admission to the ED for an overdose or for addiction issues before it ever occurs.
Yeah. Well, thank you.
Yeah. Great.
There was a couple of people that are involved in the criminal justice system on the next panel, so there is a transition here we need to make. But before we make the complete transition, I'd like to ask our district attorney and our chief of police here in Jacksonville the same question about, would you like to see each overdose death investigated as a potential homicide?
I would, and I guess because being a prosecutor as long as I've been, I've noticed that there are quite a few deaths out there that are, in fact, I believe they are related, of course, to overdoses, and then again, we know that they somehow got those drugs. I mean, these drugs just don't appear on their own. They come from somewhere, and so I'm very much in favor of that. I work a lot with law enforcement in my 4 counties. I've worked the sheriff's office, NCIS, when Robin was over there, and the Jacksonville Police Department, and I'm in favor of that because we need to try to get these people who are actually selling, delivering, providing these drugs. Right now, we've got a case pending here in Onslow County. We were just talking about it just before the forum. That case was submitted to the grand jury today for second-degree murder. And it's one that our office is treating very seriously. We met with the Onslow County Sheriff's Office quite many times. And we're in touch with the family about that, several times about that as the investigation was proceeding. And then we made the call that the appropriate charge was second-degree murder. I appreciate the legislature, and I'm going to say Senator Brown and the rest of the legislature, by making it a criminal offense and make it second-degree murder, that if you cause the approximate cause of death is caused by opiates, drugs, then it can be second-degree murder. I mean, that's it. That's what the law is. It makes it a B2 felony, and the significance of that is the punishment is much, much higher than, say, it would be for some other type of manslaughter or anything like that. I know there was a mention about the manslaughter. Of course, that was done down in Pender County. Not in my district, but I also know the district attorney's office down there actually worked on that case very hard because they were in contact with me. We actually coordinated with Ben David, the district attorney down there, during that investigation because it went over district lines. I'm in favor of that. And I know that got Major Chris Thomas here with the Onslow County Sheriff's Office. We meet with him all the time, it seems like, about different cases. And I'm certainly with the police department as well. We'll continue to meet with them, advise them. And if we have a case and we can prove beyond a reasonable doubt, I'm going to recommend charges.
Chief Yanero.
Well, one of the things I think we've done is we've changed our police protocol to require officers, when they go out on a crime scene like that and an overdose, to treat it as a homicide scene.
Right.
And that includes getting a lot of the information that we normally get on a homicide. You know, because these types of cases are very complex. And I think what you have to look at is, when you're talking about these particular types of cases, the investigations are not like they were when I was a patrol officer. You know, when we were dealing with drugs 30-some years ago, we dealt with them on the street. We dealt with them, but now those cases focus around social media, telephones, text messages. Those are the kinds of things they make contact with. And I think it's so important that one of the things that we have done with the police department is we have a full-time forensic investigator to bring that data out. And it's not just those fatalities, it's also the ones that are non-fatal. You know, because we'll typically go out and we gave Narcan 24 times last year. And one of the things that I think happened is that we investigated each one of those cases trying to get that information so that we could be successful in prosecuting those cases, future cases, especially when those drugs are related. Because remember those chemical compounds that we talked about, the synthetic fentanyl, those types of drugs that are coming from China and coming from other places. One of the things that we have to do is to be able to find those and be able to link those with cases so we can make those cases stronger. So those cases are extremely complex, and that's some of the things that we have to do. And I'll thank Senator Brown too for a couple of the things that he did. First, the STOP Act, and two, changing the controlled substance law to include the analog of those crimes that are coming, or those drugs that are coming from China. Because that gives us, as he did when we had the spice and the bath salts conflict, he sponsored bills and was involved in getting bills passed so that we could actually prosecute those. Because to be frank with you, we had cases of people with fentanyl that we couldn't charge with felonies because they weren't on the controlled substance reporting system. And now we're able to do that. So I think we, as the police, are going to have to change the way we do things because these drug cases are so complex.
You know, Rob and Jay, I'm not ignoring you. I'm going to talk to you in a few minutes about some of the treatment issues that are before us. But I do have another question that's related to this that I'd like to ask to the criminal justice people that are here. And Sheriff, I would give you a chance to chime in on this as well. And that is, there's been a lot of talk about the LEAD program. I think it's been undergoing, it's in various places of starting around the state. I think Fayetteville has gone pretty far with it, and now Wilmington has picked it up. I'm not sure exactly where we are here with it, but maybe Chief Yanero or Sheriff Miller, you can tell us exactly what your feelings about the LEAD program is. The LEAD program is law enforcement assisted diversion. It actually allows people who are struggling with drug addiction to be diverted into prosecution and into long-term mental health care programs. Actually, they would never be arrested, is my understanding of it in most cases.
Yeah, that's right.
How do you feel about that, Mr. District Attorney? Could you use a break from that?
Yeah, I'll tell you, Chief and I have talked about this for some time. Look, my job, I have two constitutional duties. One is to advise law enforcement, which I do on a regular basis. It seems like every day I'm talking to some law enforcement officer somewhere in this district. That's one of my jobs. My second job, though, is also to prosecute cases. Now, prosecute, though, ultimately means to seek justice. It does not mean that my job is to send everyone to prison. That is not my constitutional duty. My job is to seek justice, and justice comes in many forms. And I can tell you, when I say that, sometimes justice does mean treatment. Because particularly with these individuals, and I've seen it since I've been a prosecutor, it's like a revolving door of individuals who are users, consumers, who are addicted, who will come to court with charges for possession only. They will be placed on probation, generally violate probation because they're still addicted. They test positive. They go to prison. They come back out. And what do? They go right back running with the same crowd where they're getting their drugs before and become addicted again. It's just a revolving door like that. I'm in favor. These people have got to get some treatment. I did like one thing that the doctor said here. A lot of it is mental health issues, too.
Absolutely.
I've seen it repeatedly in the courtroom. And I am very much in favor of treatment. Now, in saying that, those that sell, deliver, that traffic in these type of things, they've got to be punished. They are making money off of others, and they've got to be punished. And I will thank the legislature for making some mandatory minimum sentences, particularly in the trafficking offenses that we use quite often in this county, in this district. But yes, I'm in favor of those type programs because, look, if we can catch this one person, get them the treatment they need early in the system, that's probably one less person I've got to prosecute multiple times. And it's to the point now, I've been with the DA's office so long that I have actually prosecuted now, start off with some grandparents going down to their children, because it's been a repetitive cycle in these different families. So I'm very much in favor of using that.
Chief, I think I heard an amen from the district attorney side of the table.
Well, we've been talking to the district attorney, Dr. Gilbert, who's our crisis counselor, has been working with some of our partners on the LEADS program. So we're far into the LEADS program, and the LEADS program is about saving one life at a time. And that's basically how we're looking at it. Can we divert somebody who is using those drugs into a treatment program and be effective? And what we've seen across the state with a number of those programs is that the program is very effective. It requires, though, it requires us to have immediate treatment, which we don't have in this community. If we have somebody in our police department today would be referring people to a LEADS program if our mental health services would provide somewhere that we could take them immediately, because that's the way these programs have been effective. The HOPE program, which is a program in Nashville, North Carolina, has served about 200 people in a program very similar to this. And the key that they have is they have a detox center in their community. So that detox center is providing immediate service. So at 11 o'clock on a Sunday night, they need somebody for service. It exists for them. It doesn't for us. After 5 o'clock on Friday, we have no services that we can provide them. And when somebody is needing of treatment, when they need treatment, and they make that commitment that they're going to get treatment, and it's not available for them, the addiction becomes so strong, they fall back into it. So for us, and we've had numerous meetings with the district attorney, numerous meetings with some of our partners in the mental health community, and until we can provide that immediate service, the program is not going to be effective. We've got to be able to provide that service. We've got to find some alternative. And I'll thank Senator Brown again for that $1.2 million. And I'll also thank the county commissioners and city council people in this room, because they got together and they're looking at it as center. Now, that center is supposed to open sometime in June, but the problem is, between now and June, how many folks are going to fall through the cracks? How many times are we going to go out, like we did last week, on an overdose where we gave Narcan 4 times to that individual before that, and the 5th time we weren't able to save them because we didn't get there in time? That first time, if we'd had a LEADS program, we might have made a difference. I don't know. But our problem is that we don't have those kinds of services readily available to us 24/7, 365 days a week.
Sheriff, would this program could be something that the Sheriff's Department would be interested in as well?
Absolutely. I agree with what the district attorney and the chief said. Here's the situation. When we have somebody that is addicted, that is a disease. Okay, yes, they committed a crime by buying it. However, it overshadows by the fact that they are addicted, and it's a disease. If that person comes in and self-reports, or if a close family member brings them in and they self-report, they find out that, okay, this is who I am, this is what I need, then we need long-term treatment. It's not possible to unaddict somebody in a short term. It takes a long treatment facility where they provide the counseling and the proper treatment, and then if they submit to that voluntarily, and then hopefully will stay clean after the fact. Now, there is a difference between dope peddling and addiction. Addiction is a disease, but sometimes there is still overlap, so we have to consider that as well. If somebody peddles to feed their addiction, they're committing a crime. So LEAD program can be effective, but it really depends on the proper protocol being established for long-term treatment.
Okay, I want to move to the treatment side of things. I know you probably have some feelings about the LEAD program, as you've heard it described here as well. But first, most folks are familiar with our Sheriff's Department and our county commissioners, but I want to talk to Rob McCartney of the Barry Robinson Center and Jay Quartermeyer of the Bryn Mawr Hospital. Tell us a little bit about what your programs do, so especially as related to opioid crisis.
Yes, Bryn Mawr Hospital, we're a 102 licensed bed hospital, psychiatric hospital. 2/3 of our beds are for children and adolescents. So one of the things that we've found that Eastern North Carolina needs is treatment for children and adolescents. We had a very limited number of beds that are licensed. These are all licensed beds for adults. We have 12 psychiatric licensed beds to treat adults for psychiatric symptoms. Many times, as we all know, it's a dual diagnosis. It's an addiction along with a mental health disorder. Reimbursement for both of those diseases is such that we have to treat it in a very limited stay. Most of our stays for adults are 7 to 10 days. What's needed in really treating a disease long-term recovery is levels of care, a good continuum of care in a community. It's not just inpatient, it's not just outpatient or detox, it's a whole continuum where an individual can move through based on their level of affliction with that disease and their treatment needs. We do provide inpatient acute psychiatric care. 80% of our admissions are on an involuntary basis where a patient was seen outside of our hospital by a physician or another professional and deemed to be a danger to themselves or others. We're a locked facility. They are committed to our facility. We actually work with the court system. They go through a hearing. So they're there by basis of keeping themselves and the community safe. Once they're stabilized, we discharge them. One of the issues that we have is really a placement. Where do they go afterwards? Again, we see them much like the emergency room in an acute phase. That's a beginning. That's a beginning of a journey to recovery. The difficulty and the community needs that we see here in not only Jacksonville, Onslow County, but Eastern North Carolina, is a limited number of other providers to provide a good continuum of care. So.
Okay. And tell us a little bit about the Barry Robinson Center.
Oh, with pleasure. We're a residential treatment center for children and adolescents from ages 6 to 17. The kids that come to us come with a variety of diagnoses. But what we've seen over the last 4 or 5 years has been an increase in referrals for kids, especially teenagers, who are suffering with the dual diagnosis. They have a psychiatric illness, but they also are having a very active substance abuse problem. And then we've seen an uptake of referrals of kids who are having opioid issues. And what we've also seen is an increase of our younger kids, our 6, 8, 9, 10-year-olds, as we start to do histories on them, whose parents are having a severe substance abuse issue. And so we talked about it being generational, and even kids growing up within a substance abusing home, the trauma, the neglect, it becomes self-feeding, and it can be very sad with that. So about a year ago when all this was going on, we decided that we would develop a dual diagnosis program. We call it SMART, self-management and recovery treatments. And we've been doing it now for about 4 months and continue to get a lot of referrals. 90% of the kids we work with are military-related kids. So we do a lot of work with the military. We do a lot of work with Trillium as well, and as well as commercial insurances. I'm blessed in the sense that I work for a nonprofit organization that has a very understanding board. It doesn't, that gives me a lot of latitude of keeping some kids longer than maybe they wouldn't at other places. So it's fortunate with that. I think from a treatment standpoint, we've talked a lot about enforcement and about cutting off the supply, which is critical. Then you get into the treatment. And in one phase or the other for the last 30 years, I've been doing work with substance abusers. And I can tell you, I have never met an addict that liked being an addict. Just never met it. They hate their life. They hate what's going on with them. They're looking for help. The challenge is often getting them help. I think if there's one thing that we can do as a society and as a parent of a child who may have an addiction is really get past our denial system. I think communities also have strong denial systems. And as individuals, we have denial systems. As parents, we have denial systems. And as addicts, they have denial system. You get past the denial system, then all sorts of things start to blossom for you. Treatment becomes opened up. You all of a sudden realize I have to commit resources. If I'm an addict and I say I'm an addict and what I want is recovery and I'm going to do everything I can, it may mean I don't go to Disney World, right? It means my money's going to go to my treatment. It may mean I don't get to go to a fancy treatment program. It means I go to a place where I can have a sober living home where, I'm having to work and I'm sharing a room. And it may mean that I'm no longer keeping my car, or it may mean I'm taking a job that's not as stressful. But it becomes that denial system. And one of the things for treatment that we're doing and having some good success with our kids and our parents is looking at, three concepts. One, the pain that goes with the addiction. People don't pick up pills or there's not some type of physical or mental pain. They continue with it because they're addicts and they got addicted. It feels good. It's like that first cup of coffee in the morning, right? We sort of get a jolt with that. Those, sometimes it's that drink when you come home. It just feels good to them. We also know that with our young kids, their brains are still developing, at least up to age 24. Think about how scary that is. And if we can do early intervention and education and get kids to be, to come forward, to talk about their peers, to have parents step forward as I know my addiction's hurting my child. So we can sort of stop it with that. So we look at the pain, then we look at the denial, and then we look at the skill set. Recovery is a big skill set. Part of that skill set can be going to a 12-step program. Today, while it doesn't work for everybody because of brain chemistry, there's a lot of good stuff coming out, what's going on with our brain and the redesign of our brain due to drugs, and even with our cell phone redesign stuff. Cell phones, I've shown an addictive process, they increase the dopamine level. So being able to look at those issues that create addiction and set our children up and us up as well for immediate gratification. But you can learn a skill set. It could be if you think you may have an addict in the family or somebody who's using, or get yourself to an Al-Anon meeting. Address your own denial system, and that can help you be supportive of that. There's nothing worse as a parent when you know the child is an alcoholic or an addict, and you feel like you need to do something, even if it's a 35, 36-year-old child, but you can't, because sometimes we help enable them with that. I think a very honest and open dialogue comes with treatment. And those are things that don't take a lot of money. A lot of stuff, enforcement and prevention can cost money, and sometimes some simple things with treatment can. Again, I'm not telling you it's easy to get through an addiction. And relapses, we talk about as part of recovery. But I can also tell you there's a lot of hope. I'm seeing with Generation Y that's coming up. We see an increase, the millenniums, right? 16% of them go to church. Generation Y, 45% of them are going to church. There's a reaching out for some type of spiritual peace, which is, I think, big part of recovery.
We need to keep this, I want to ask you guys this question, but we need to keep it short because we're going to get to the guys that have all the solutions, and that's important. But when specifically, Jay, you live in this community or you work in this community, you're familiar with what's going on here. You see but you also see things where the rubber meets the road, so to speak, with the treatment. And as you do, Mr. McCartney, let me ask you guys, if you could advise a community of what they can do to make a difference, what would it be?
One of the things I've been in this community for close to 10 years now, but I've been in other states, lived in other areas. One state that I lived in, which this was 20 years ago, decided that the problem was so severe that they needed to tax themselves as a community to support and reimburse treatment for that community. So they imposed a levy and taxed everyone in that community to make funds available for good treatment. And that's something that, as a community, taking responsibility for that versus throwing it to outside agencies, or it was one model that, quite frankly, I saw work for a period of time. If I had the answer right today, I wouldn't be sitting here. The state of North Carolina has many difficulties, and Senator Brown I'll thank him again for all his support for treatment. We as a state, we as a community have to look at the whole system, how we treat people, how it's funded, where the money comes from, what are we spending it for, and holding people accountable in the system for that.
You know, I'm going to agree with the chief. Immediate access. If you have somebody who's asking for treatment right now, and they even have to wait 24 hours, they're going to slip away. So being able to have, understand if immediate access is the focus, then you design your systems and you develop your funding to get that, because they need to have that. And they see it, how many folks do you see who, if you could get them treatment today, maybe tomorrow they're better?
Okay, well, thank you all. Now we are going to move to the know-it-alls, and I know they don't, and I'm just kidding, because I understand the battle that you go through. You know, you were talking about a levy, and I'm sure that when Senator Brown was putting together the state budget, he could see just how squeezing that budget and getting the dollars that you can get can be difficult. We're seeing the same thing on the county and city level as we attempt to move forward with some of these programs, specifically the detox or the treatment center. But I want to go through each to start this, and then I would like for other members of the panel, please, to join in as we ask these guys questions or just make comments and get their response. But I would like for you to talk about what your organization at the county and at the state and at the city level would be, what you're seeing, what you have seen happen, because as we have heard, a lot has happened here since we first started having these town hall meetings, which is why we wanted to have another town hall meeting, because we want to talk about the fact that, you know, a year and a half later, you know, some good things have happened. Mike Lazzaro, we'll start with you. What's the city?
Thank you,
what's the city
Elliot.
been working?
Well, I'll begin by saying that it's wonderful that we have the recognition of this epidemic that we suffer, not only in our country, but in North Carolina, and which affects every city and every county, over 100 counties. And so we recognize that there is a major issue within our communities. I was having a conversation with another elected leader not long ago, and he said, well, how is that a city problem? Mental health is a county-funded item. I said, are you kidding me? It's every city's problem, because our first responders, our officers are being asked to be law enforcement officers. They're being asked to be psychiatrists, psychologists, you know, and we're having extreme difficulties in training and providing funding for training. But at the very least, our citizens are crying out for help. We've got a mental health epidemic in North Carolina. And anybody that doesn't recognize that, while substance abuse is certainly a big part of it, there's a mental health crisis. Because it's all interlinked. And everything that's been said here today is so important. And as community leaders, we have to recognize that we've got to work across the lines. We've got to work with our federal partners. We've got to work with our state partners. And locally, we got to work with the partners within each communities, meaning the education part of our community, our law enforcement part of our community, all of our partners, because the epidemic is so broad. You know, it starts at this, you know, we can talk about the school level where, you know, teachers are seeing young kids, they can't sit down, and next thing you know, they're convincing parents to put them on some sort of medication so they can sit quietly. Well, that medication eventually leads to other medication, which ends up leading to substance abuse. And we see that. There are statistics that support that. So the problem is very broad. So again, the partnership that we form with the county and the state, and Senator Brown, you've been extremely helpful in providing funding for our new crisis center. We're going to continue to advocate for accountability. The pharmaceutical companies and the doctor shopping and the overprescribing of medication has had a huge impact in our community. I mean, I know of people that they got started with their parents' medicine cabinet because parent got a tooth taken out and they had 3 months supply of a heavy narcotic. That's got to stop. And there has to be accountability, not only on the public side, but the professional side. You don't need 3 months' supply for something that's going to last 2 weeks. And again, I'm not a medical professional, I'm not trying to be, but this is a fact. And then the other thing that we've got to look at is this early prevention, this diversion programs. They're extremely powerful because, again, we talk about holding people accountable for, selling. Well, it's a vicious cycle. Your son or daughter gets addicted to narcotics, and then when they get addicted to our narcotics, you're being taught as a parent, hey, you got to cut them off. Don't give them any more money. You got to throw them out. You got to treat them like animals. So what happens is they go out, and how are they going to support their initial need? Because there's no initial treatment that they could go get. So they're going to get something, and they're going to try to sell it to meet their needs. So now they get into the criminal justice system, and it's a continuous spiral. So it's a much broader problem than a one-pronged solution. So we've got to look at these diversion programs. From the criminal justice, we've got to really analyze them. We've got to be able to separate pure criminal acts, or are they subjective because of what they've become? I think that needs to be talked about, and I think it has. But I think that as leaders, we've got to continue to provide funding to our public safety department so they can continue to be educated. I guess most of our officers have been through crisis training.
Crisis intervention training.
Intervention training. And I think we also need to find ways to look at there's other states, I think in Maine, they're training some of their city and county employees to administer Narcan, because people may be out and about doing their daily work, and they may come across somebody that may need and can save their lives at that particular time. These are just strategies that are being used in other areas. In other words, we've got to continue to educate ourselves as leaders, to work with our state partners, but at the end of the day, we've got to ask the state to relook at mental health in North Carolina and how it's being funded and how it's being administered, because it's not working as we see it presently.
And to take off of that, the biggest thing there is the CIT training that you just mentioned that Sheriff has been involved with, and Chief. I work at the college, so I run that training, and right now Dr. Gilbert's out here and she's doing training this week. We have 1 week of school going on right now, and we're training up all these officers, but we have no facility. So our officers are tied up for how long? Sometimes 45, 50 minutes. Sometimes, Dr. Gilbert, 2 or 3 hours are tied up with a mental individual that they have to deal with. But the working relationship that we have right now with the city and the county and the hospital is the best it's ever been. And I've been a commissioner for 13 years. It's the best it's ever been, and it's going to get better. But we have to work together. Robin has worked very hard with the Crisis Center. I mean, that's his baby. I mean, I'm going to bring it right on out. He's really been pushing that hard, and all the commissioners are on board for that, all 5 of us. And I can tell you right now that the meeting we had, a month ago, 2 months ago with the city, it was amazing for all of us to come together. We got a problem, and we're going to have to fund it, and we're going to have to figure out how to fund it.
Can you tell us where we are with the program right now before we move over to Senator Brown? Because I know he gave you, he found a good source of funding.
Well, he came out with, I think, and he can correct me, it was $1.6 million to start with, and then all of a sudden we get this phone call, he's got $2 million for us, and that's bricks and mortar to bring that facility up to speed. And I know Sherry's out here in the audience, and she knows a lot about that building because she's been working so hard for us as one of our managers in working on that facility. And then I understand that June is when it's supposed to stand up. Is that correct, Chief? I believe it's when we're supposed to stand it up.
Senator Brown, where'd you find that money?
Well, first of all, I want to thank everybody for being part of this, because it is a problem. And I can tell you in Raleigh, everybody knows it's a problem. This session, it was probably talked about more than any session by far. And a lot of money in different areas was put into opioids in particular on how we try to fix them. I want to also thank the chief in particular, because he has really facilitated several meetings, but Ernie, Jay, Penny, for several years, I've been talking to these guys, and they have kept me informed on the issues that they deal with every single day in this community. I know Penny at the emergency room, I've heard this conversation, I can't even count how many times, how it's a revolving door for her on those mental health patients coming into the emergency room, the worst place they could be. Then the sheriff's department's got to hire someone to stay and watch over this patient. So the cost to the county is probably running in the millions a year to take care of that particular issue. But the worst part of it is the emergency room is not where they can be treated efficiently and correctly. So it's just been a bad system. So I've tried to listen to some of these concerns in the county, and I have really tried to figure out how we can fix it here locally, and across the state as well. You know, the spice issue was mentioned earlier, and that was brought to my attention several years ago. And I can tell you, the people that are producing this stuff change that formula. Every time you try to chase it down, they change it to try to get ahead of it. And it's a constant battle trying to make sure that you can fix these issues and these drugs that are out there affecting our citizens. Mental health, though, is truly a real issue. And it's probably, in my opinion, handled the worst by the state of any issue we deal with. And I think the reason it is because if you've never experienced it in your life or in your family, you truly don't understand it. And I think it's the least understood issue in the state. And that's what makes it difficult to fix. And as you know, the LME-MCOs, now these things are huge. Trillium takes in how many counties? I don't even know anymore. Where it used to, we just had Onslow and Carteret County had were together working on mental health, and now it's about 40 counties with Trillium, and the state has gone back and forth on trying to fix this issue, and it's difficult. And nobody has really fixed it. And the real part of it, I guess, is the money. It takes money. And you try to manage the money through these entities, but by doing that, you sometimes don't really fix the problems. And that's what's happening. And Trillium, I think, particularly, because they're so big, Onslow County is just one county that they're having to deal with. And it's been a struggle for us, I think, in Onslow County, trying to get the resources we've needed through Trillium. When we sold the Dorothea Dix property in Raleigh, that money was put in a fund to be used for mental health. Well, when I knew we needed this facility, I went and attacked that pot of money. And after I went and got $2 million, it's funny, but several other legislators found $17 million out of it as well. So now we got several centers across the state that will be built or refurbished to address some of these issues we got. But that's what that money was for. So I think that's going to be a start of maybe some good things across the state. Some other things that we've done, the STOP Act was mentioned, and that just really tries to address these addictive drugs and how they're administered and overprescribed, try to address those issues. We've also invested $1.5 million last year, $2.4 million in this past budget on the controlled substance reporting system to try to track this stuff and how it's being overprescribed and who's doing it, and really get our hands on some of that. We put $10 million for other treatments across the state. $5 million for 3-way beds that treat people with mental illness and substance abuse in their local communities was in the budget. The feds sent us about $40 million. And of that $40 million, about 80% of that is going for federal grants for opioid services that are spent to increase access to recovery and treatment services. So there's a lot of money that are going toward this problem, but it's a dang big problem. And southeastern North Carolina, unfortunately, is one of the worst. You look at the statistics, we're one of the worst, and that's sad that we are, but it is. And it's going to take a team effort for us to attack this thing. And I know the state is committed to put money into this issue, and I'll do everything I can to help the state and in my district in particular to address it. But it's going to take teamwork and a lot of conversations, and it's going to take community involvement, to be quite honest. This thing is so big, and again, it's one of these issues that if it's not in your family, it's kind of out of sight, out of mind, but it's in a lot of families. And a lot of people are dealing with this. And I know in my business, I'll give you 2 examples. I had a manager, a good manager, that worked for me, had a back problem, got addicted to opioids, lost his job, lost his family, lost his home, lost everything he had. And that's a sad story. And I mean, I went to church with this individual, great family, lost it all. 2 days ago, in my dealership, I had a lady walk in my Volkswagen store, and my guys recognized in about 5 minutes that this lady was really strung out on some type of drugs. And so they called law enforcement, and law enforcement came. She tried to get away. She ran, and hopefully they got her, and hopefully got her some help, but just walked in the door in one of my dealerships. I mean, that's how prevalent this stuff is across the state. And it's so sad. I mean, it's so sad. Good friend of mine with depression worked for me. Great worker. For 20 days out of the month, as good as they come. For 5 days out of the month, couldn't work at all because of depression. And these mental health issues are tough issues, and it's going to take time, it's going to take a lot of money, and it's going to take a lot of work because it's so misunderstood. And I agree, if you don't get treatment and get it as quick as possible, it just continues to spiral, and I think it gets tougher and tougher to treat. So again, I think on the state level, there's a lot of recognition of this, and I think there'll be a lot of money put in it. I know there's also several pilot projects. One is in Wilmington to try to address this issue. It's hard to throw money at it if you're not sure if the money's going in the right direction. So hopefully some of these pilot projects will give us some light on what treatments are working and what aren't, so we can direct the money in the right places. But again, I think you'll see the state really step up and spend some money to try to address these issues.
I want to go back to Commissioner Buchanan. There might be some other things that the county's been working on that you'd want to bring up, but also, what do you see as the role of Trillium in all this?
They have to be a partner. You have to have them as a partner because of the monies and whatnot that pass through from Trillium into the county. And to help Harry out on the other issue he said a while ago, there's 25 counties. Years ago, it was just Onslow County by itself, Onslow County Behavioral Health. Then it was Onslow Carter. Right now, there's 25 counties that are in Trillium. And Trillium is the one that the money has to pass through Trillium to us. So that's how.
Yeah, I understand, and maybe I'll bring up a contentious point here. I hope not, but in any case, I understand that part of this was to save money because you can pool resources and do some things together so that are more expensive if you do them apart. But is it true that they get to keep some of the money that they save, and is that necessarily when you need a service expansion like what we seem to need now? Is that a formula that would work? It's not their formula; it's the formula that I guess that we came up with as a state. But I guess that I would ask you too, maybe. Do you think that's a formula that works?
I can answer that. Of the LME MCOs, Trillium actually has done the best job of getting money out for the services that are needed. Mm-hmm. But there are several LME MCOs that have built up a huge cash reserve, and I feel haven't provided the care that was needed across the communities. And that has created a problem. Right now, the LME MCOs have about $1 billion in reserves. We as legislators feel like that money needs to be out in the communities. It doesn't need to be in reserves. Exactly. And so that is a contentious problem we're having with the LME MCOs right now. So it's a tough issue. There's a real battle there.
And I think that ties in exactly what Commissioner Knapp was alluding to. We have a community of 180,000, and we don't have anywhere to take people that have a need.
Correct.
We do not have one bed that we can take someone that needs some help today. And that should not be that
Shouldn't
way
be that way.
in a community of
Well,
our
and
size.
to the taxpayers too.
So,
Let me hit this real quick for Rob.
Yeah, I want to go. Let's give Commissioner
We give
Buchanan a chance.
$500,000 a year to Trillium. That is taxpayers' money. That goes to Trillium. and I know Robin and I have asked the same question before. We asked the question of Trillium one time in front of us, and they couldn't give us any answers to the money itself. And it still concerns me, where does the money go? But that's what the taxpayers are paying. But right now, it's going to cost us, and I think, Robin, you can correct me on this one, it's going to cost us $1 million a year to operate.
1.4.
$1.4 million to operate the facility. We have to do it. I mean, there's no way around it. We're going to have to find the money to do this, along with Trillium and with the state and the feds and everybody that'll help us. But it's going to be expensive. And I know we did try to bring another county in. Carteret County came to the meeting, and I know that Commissioner Knapp and I had a discussion with one of the commissioners, and he committed to us, but another commissioner did not. We don't know what's going to happen with Carteret's side of the house.
Well, let me address that real quick. The biggest thing, and Senator Brown, you said it right. One of the biggest things was, where was our money going? Commissioner Buchanan and I asked in a BOC meeting, actually we asked a very simple question. I mean, I could care less about the other counties. I care about Onslow County.
Correct.
So I wanted to know what our money that we were providing them is being used for within our county. I couldn't get an answer. So part of this initiative, and basically it's Onslow Carteret Oversight Committee. This is our task force that we formed to get this facility up and running for the mental health detox portion of it. Now, addressing your question about Carteret County, we did have a little faux pas there with one of the commissioners, but a couple of nights later, that commissioner called me, apologized, and they got everybody on board, so we're good to go. And basically what it is, it's a partnership. It's a partnership between the city of Jacksonville, it's a partnership with the OMH, it's a partnership with Carteret County and Onslow County to combine funds, okay, to get this up and running for at least 2 to 3 years. It's a start. That's what we want. We have to have something. And Commissioner Buchanan's right. We didn't have anything. We had 186,000 people in this county. We didn't have a facility. One that shut down in 2012, I believe, but yet the building was still running, which made absolutely no sense to me whatsoever. But we're getting it going. And through the hard work of the administrative staff in the county, they got a hold of Senator Brown, which I thank you again for finding that money for us. And we formed this committee, and this committee has been fantastic. It's a joint partnership that is working together on this task force to get this rolling. Because, we have to make a start. And we were lucky enough to find the money from a capital sense to get the things going as far as buildings, equipment, et cetera. And we are really pushing hard to get this up by June or July and to get this facility up and running so that this county and Carteret County have access to this particular facility. It's not an end-all, it's the beginning. It's the beginning to start the prevention or start the treatment cycle immediately here and then move on to the next level. So I'm very excited about it, and I think when you see the committee working, it's a joint partnership with Trillium as well. It's a joint partnership with them to ensure that we get the services that are needed and that are warranted for our county.
And I will address it to this side of the table here. You talked a little bit about a tax levy that specifically addressed this problem. But I will say, just from things, because I'll talk on the radio and I listen to people to call in, I will tell you that's not necessarily an easy sell. There are people who don't want to spend money on what they call drug abusers. It's that they don't see why that should be a taxpayer burden. But maybe they don't see the other costs that are involved, including the human lives that are being lost. But there's so much the money that's being spent. I don't want to make the argument here, but what do you say to those people?
There's a cost, and you're going to pay for it one way or the other. That's what happens.
Yeah.
And so that's what makes it so difficult. Where the cost, who pays? Maybe you can make that argument, but somebody will pay. And what it does to your community long-term, those costs, if you don't address it, are huge costs. Because when your community becomes that community that's known for those problems, what does that cost? Yeah. And, so those are the type of things you got to look at. And it doesn't take long for that perception to happen. So that's why I think you got to address it as quick as you can, and it takes a whole team.
And I think that One other thing, and Harry, you can correct me if I'm wrong on this, I think we're allowed one more quarter-cent sales tax. Is it a possibility for another quarter-cent sales tax for us? If, we have to let the people vote on it, but I would think the community would vote for that type of a quarter-cent sales tax if it went to mental health.
That's not in place as of yet, but it is being discussed.
Okay.
Sheriff Miller.
I think none of us that are participating in this forum have all the answers. However, I think if we form a team, for instance, if we have a multidisciplinary team, we have citizens groups, we have medical, we have social services, we have political leaders, we have law enforcement, we have a school system, because a lot of times we have got to do something for our children and get them away from the opioids. The faith community, we reach out to them, and the commercial sector as well. If we stand together as a community, we might make a difference and form a protocol that is part of the solution. And I also want to say public awareness. Public awareness is absolutely paramount, because a lot of times people don't know what's going on unless we tell them. So the news media and talk shows and printed media, TV media is very important to let them know, let's find a solution.
Dr.
Sheriff
Deal.
Miller just read my mind. What it speaks to is the need for a coordinated infrastructure. And while we're well on our way to that, I look back to a couple things, and Chief Yanero and I were talking about this before the forum started. The very worst place, but a necessary place for a substance abuse or mental health patient is the emergency department. The very worst place. But the reason they're there is because we serve the purpose of medical clearance. So we have to do that. Law enforcement has their pocket. There's things they have to do. They're a required element. But without the coordinated infrastructure to pull all those various pieces together, to coordinate the education, to coordinate the continuum of care, which we don't have. We don't have the pre-piece to address the mental health issues that feed into substance abuse. We have the acute piece handled pretty well. Not perfect, but pretty well for the acute piece. But we do not have the continuum of care that takes the person out of the hospital for medical clearance, puts them in treatment programs, addresses all the reasons why it contributed to their addiction, the illicit drug flow, the overprescribing of medication, and then the treatment programs post. And that's a forever thing. So education, absolutely, but it requires a coordinated infrastructure that currently, we're on our way, but it's lacking right now.
Chime in real
I want
quick.
to mention too, that you have seen this, now that you're the president of the State League of Municipalities, I wanted to ask you, is the same, are you hearing the same things?
It is, yes, to answer your question, yes, and it is one of our initiatives for the year. This is one of our number one topics, and we will continue to work on it all year. I was going to mention earlier that maybe we can ask to get some legislation enacted that requires the pharmaceutical companies to put in a certain amount of funds for every pill dispensed that's a narcotic or something of the fact, for treatment. Again, if they're going to prescribe it, maybe they should facilitate the research and treatment.
It's been discussed.
So that may be an option. And to talk about the tax implication that you were alluding to earlier, in the city of Jacksonville last year, our officers spent 16,000 hours, $1 million in monies handling mental health issues. So it's already costing the citizens. It's a problem
No, it's a
that,
problem.
whether you're city, county, state, federal, it's our problem. And we have to deal with it together as partners. And we got to continue to educate and to work on solutions and problems.
Well, we've about run out of time here. I would say that there's a little bit of time left if somebody wants to say something. If you don't, I'll say something, which is some of the solutions that all of you have been working on and that you represent. We've talked about the taxpayer and just finding the right place for folks. But really, the people that I've known, it's the families. It's those mothers and fathers who really, it's the choice between sometimes the emergency room and jail.
Those are the only choices.
And those are the choices, and that's not a choice they can live with. And unfortunately, it becomes a really difficult, I know you guys deal with that all the time. And sometimes they end up in the lucky ones end up in your care.
But it's about saving one life at a time.
Yeah.
And it's about meeting people where they are too. And I think that's the greatest gap that I see is that we have opportunities here. We have opportunities, as police officers, we have opportunities to take these folks and to get them into treatment if we had treatment available immediately. And I think for us, that is a real challenge. Because when we're given Narcan, we did that 24 times in the last year. When we're given Narcan, if we had an opportunity to take those folks, I mean, there's probably some that we could save if we just had access to services. And listening to fathers and listening to people talk about the challenges they have in getting people into mental health services, it shouldn't be that way. We should have some form of immediate services that could provide that.
Thanks. I'm gonna call Ralph Leeds back up. Some folks, we didn't have time for questions from the audience today, and I apologize that some people filled these out. But I'll tell you what I'll do. I'll make sure that I get these around to try to find the people that are relevant, and I'll send them to you and let you, well, we don't have names on them, but if you'll come up and put your name on them, and if you don't mind doing that, I'll be happy to make sure that you get an answer to the problems or to the questions that you have. Because I know it's important. We had so many folks speaking today that we didn't think we'd quite have time. But I really appreciate the contributions. I think the picture that I see is one that, we've come a ways, but this is such a big problem and we have such a long way to go. But thank you very much.
Thank you.
First of all, I'd like to thank all our presenters for participating in this forum. As one who used to work in the public sector, I can only tell you that I used to see mental health issues on a daily basis, and it is as severe as they said. I'd also like to thank our corporate sponsor, Duke Energy, our media sponsor, the Daily News, and our partner, the City of Jacksonville. And if you missed any part of this forum Onslow, you can check the listings for G10 for rebroadcast dates and times. And with that, we are officially over. Thank you for your attendance.